Hi, everyone. Today I'm joined with Helen Winter, a registered nurse in emergency in Ontario, and one of the administrators of Nurse with Sign 416 that you can follow on Instagram, Twitter, YouTube, and TikTok. Helen, thanks for joining me today.
I'm glad that you're here with me too. Thank you so much for asking these questions. They're so important at these times.
Absolutely. So we've witnessed definitely in the last while how important the healthcare sector is to the entire economy. We've witnessed that, for example, without a healthy population, there's no other part of the economy that can function. So healthcare is such an integral part of that. What do you think that people should consider in terms of healthcare as we kind of exit the pandemic, post-pandemic? As in, what do you think is needed going forward in healthcare?
Well, what we've seen on the front lines is particularly what a beautifully functioning healthcare system we have when it's appropriately supported. Primary and secondary levels of healthcare, those were not functioning during the pandemic. Everybody ends up in emerge, which is one of the reasons why emergency care is just it's so challenged right now, aside from the other factors like the nursing shortage and the targeting of nurses by this government. Primary and secondary care are so integral to population health. You need to see your family doctor for those minor things that might not be minor after all. You need to see specialists. We don't encourage anybody not to come to emergency, but like everybody deserves medical care. We've certainly paid for it. Where's our money going? Moving forward, we need to have nurses back at the bedside. Bed shortages, which result in more people hanging out in emerge for longer than they need to be. That's all from nursing shortages. We have enough beds. We need nurses. More than anything, we need a commitment to support public health care, period. Privatizing is not the answer. It costs everybody so much more. It results in substandard care. It's not the way to go. We need a commitment to public health care. Public health care is not only integral to a functioning economy, it supports, along with public education, it supports our ideas of what society is. You cannot have equality. You cannot have opportunity without these things in place. Every Ontarian needs healthcare. Every child needs an education. So when you put a money value on that, where your access to these things depends on your paycheck, we have a much different society than what we all assume we have. So those are the questions we need to ask ourselves going into the election. Who's talking about privatizing? Who's going to support taxpayers, working class people with the money they already give? Let's start asking the questions.
I think that's an important point too, because when you think about it, that's basically raising like, what is the direction? Like, what's the aim of healthcare? And if the aim of healthcare is to kind of siphon off different parts and privatize them or have people make money within the system, well, that's not looking at human beings who require care in order to, live a comfortable life, in order to participate in society, right? And so that whole outlook, that whole aim of the purpose of healthcare, I think is really important to consider going out of the pandemic as well. In large part, nurses bore and are still bearing an enormous burden of the healthcare system because of that underfunding and that undercutting for years, as we were talking about prior to the pandemic. Yeah. So just like in education, where we've come to recognize that teacher and education worker working conditions are the learning conditions of our students. And I would argue that the working conditions of nurses and healthcare workers are the conditions of the patients that are in their care. Can you talk a little bit about how these conditions have changed in the last few years, and what do you think is needed to improve these conditions?
We need more support of nurses. We need raises. We need recognition of the skills that we have, because why would anybody do this kind of job? We do things that you can't ask another human being to do, and yet we do them. You know, when everyone else is running for the hills, we're running into the room. We need better working conditions for nurses. I think just as in education, when teachers are speaking out and when nurses are speaking out, it's not just about us. For every one of us that speaks out, there are multiple, like tens to hundreds of people we're speaking out on behalf of. We see the suffering. Why we're far more vocal now is equivalent to the difference between if a child comes in, and I'm sorry if this is a trigger for anybody, but people need to know. When a patient comes in, when a child comes in with broken legs from falling from the monkey bars because they were playing, that's very different from when a child comes in with shattered legs from being physically abused. And that is the Ford government. That is why we're speaking out, and that is why this election matters. We need support. We need a commitment to the people, not for promises of roads, not for promises of expensive construction projects, which are guaranteed to go over budget and are just going to be more taxpayer money being siphoned off from where people need it, which is the front lines of healthcare and education.
And I think that's kind of going back to that idea of like, what is the aim of these sectors? Right?
Exactly.
If the aim is to, which is why we're able to operate all these other parts of the economy, that we need the investments that we require, and that frontline nurses and educators, particularly nurses and healthcare workers who were lionized during the pandemic, called heroes and other things like that. Well, we need to then address what concerns that nurses and healthcare workers are raising, so that we can actually, you know, address those concerns and have a healthcare system that affirms the rights of all, not just like, oh, well, this is what's left over, see what you can do with it. Right. And as you're saying, it's not, obviously, you know, sometimes these changes get more stark or more challenging during certain periods of government, but it's a whole outlook that has started for years and years. And this is why I think as well, people are starting to speak out, because they had to deal with it on the front lines themselves. They had to fight for their own health and safety. They had to fight for their own PPE, because at that point, where was the prep work? Where was the support for that?
And if we were to have a public state of emergency at this point, we couldn't. Look at what just happened last weekend, that huge horrific storm from out of nowhere. We couldn't have dealt with that. And now monkeypox coming. We can't deal with that because we have been so cut off at the knees. Yeah.
And I would think too that the working conditions of nurses have probably changed significantly over successive governments and over the years too, you know, in terms of like patient ratios, in terms of like what kind of care are we actually able to provide? Not that we don't have the human resources to do it. I live in the city of Windsor. We have a ton of nurses that go over to the US. A lot of them because they couldn't find full-time, well-paid work here as a nurse.
Well, and in the profession of nursing, we've also seen our scope of practice increase exponentially, you know, going along with this, with medical research. Like, these are good things. It's called growth, and you know, it's not a bad thing, except our pay structure has not reflected that. We do more and more and more and more advanced work. We do medical directives, you know, like ordering x-rays. We do all sorts of things in critical care, and our salaries have not increased. We require more and more specializations and certifications, and that's not reflected in our pay. Like, nurses are a bargain, for goodness sake. We're tired of being the bargain.
Absolutely. And with inflation increasing, obviously that adds an extra stress in terms of wages.
Yeah, and everybody is together on that. Like, all of our bills are going up, but we're not seeing any acknowledgement of that. And, you know, silly things like license plate sticker. Wow, that was the cost of healthcare. 1 billion towards nursing salaries. You could have had all the beds that are closed because there are no nurses. You could have had those available, but they chose license stickers. Like, that's disgusting. That is disgusting.
And that's pretty significant. So I'd mentioned kind of at the outset that on social media, people can follow Nurse with Sign
Yes.
416. Can you talk about why you started this initiative and what you've learned in administering it?
Well, the funny thing is, it's been going since last August.
Mm,
And it started because back then we identified we're in a crisis and it has gotten worse. We just felt like we needed to warn people. We needed to let people know what's going on. Because as I said, one nurse complaining is after seeing how many dozens, how many hundreds of patients suffer unnecessarily. So we needed to let people know what was happening because we felt like it was all being covered up and questions were not being asked. One thing that I have really loved about the campaign is that people are speaking up across Ontario. We're getting frontline stories from across Ontario, and it's really heartening. We see each other, and that is such a strong, strong thing. I'm surprised at the strength of it. We reach out to nursing students and they reach out to us. Yeah, the camaraderie is just, it's very uplifting. And I'm not sure how I could get through this without my colleagues. Yeah, and I do like colleagues across Ontario. Yeah. We have each other. And as the people of Ontario too, I'm not asking people to vote for big ideals. Vote for, look beside you. Who's on your street? What are the elderly people who will need care?
mhm,
Remember the beginning of the pandemic where people were looking out for each other?
mhm.
Remember when we thought, oh, 3 weeks, we're good. But like, let's get some of that back when we vote. Who else? Who's gonna suffer if I vote this way? Who's gonna benefit?
Mhm,
Yeah, vote because you care.
mhm. For sure. And I think, I mean, that's one thing that's really important. Obviously, coming out of the pandemic, I'm sure during the pandemic, is knowing that, and just learning about speaking out and talking about what are the conditions that people are facing so that they're at least on the agenda, right? They're at least
Yeah,
part of that conversation. Because in my experience, I found that if frontline workers, if we don't speak up for what's happening, if we don't explain what's taking place, it's like they can be glossed over. We saw throughout the pandemic in education as well that you have government saying one thing's happening or declaring one thing is going to happen, whereas it's either not possible or it's not happening. And so it is really up to us to
yeah,
make those spaces, to have those conversations, and to be able to ultimately say, well, why aren't we the ones who are making these decisions? We know those conditions that are facing, and the fact that you folks are doing all that work to bring people together to have that same conversation. You have a perspective on Ontario, not just a perspective of, wherever you're located geographically, because these issues are
yeah.
provincially, they're nationally, they're internationally in some cases, right? So thank you for joining me today and kind of bringing those two sectors together, education and healthcare. Um, Thank you very much for joining me, Helen.
Well, thank you for having me. It was lovely talking to you.
Awesome.